And okay, so our presentation today is on palliative care in prisons. Before we begin, I just want to mention that some of the information that we'll be discussing is based on hospice care and more broad palliative care in prisons. That's just because palliative care varies so widely between facilities, and hospice care is more definitive. So, although prison and jail are often used interchangeably, they're not the same. Jails are a containment facility where people stay while they're waiting for trial or sentencing and can often be ran by private companies. Whereas prison is a confinement I can't talk, facility for people after they have been deemed criminals by the court. They're ran by state and federal governments. And in this presentation, we'll be looking at the palliative care in prisons. So these are just some of the numbers. There are about 2.3 million people incarcerated in the United States. In 2008, the United States had almost 25% of the world's 9.8 million prisoners. These numbers are significant because with so many people imprisoned, we're seeing a significant number of aging prisoners. And some of the statistics with that is that there are over 160,000 people serving life sentences, with 50,000 of those who have no chance of parole. It's predicted that 16% of those serving life sentences will be the elderly. In the past 5 years, the percentage of prisoners aged 55 and older increased by over 33%, and prisoners have a mortality rate of 264 people per 100,000. As the number and age of prison inmates continues to rise, so does their need for palliative care.
Okay, so I'm going to talk a little bit more about how palliative care works in the prison system. So I called around and wanted to talk to somebody who had actually worked as a nurse or as a healthcare provider in a jail. And I got to talk with this lady named Ginger. She was the only one who called me back. And this is not her. I don't know who that lady is. But so Ginger worked as a prison nurse for 17 years. And she does like administration work for the Salt Lake County Jail. She worked with both men and women in both male and female units, and she said that she preferred the men because they gave her less attitude. And over the years, she got to see lots of changes and improvements in the healthcare that was offered to prison inmates. So, I jumped forward, there we go. Okay, so she said some of the difficulties she saw was that there was often a shortage in medication and updated equipment. The equipment and machines that they had at the prisons were often 5 or 10 years behind what was being used by everybody else. And also medication administration was difficult. If an inmate had a history of like previous substance abuse, then they had restrictions on what medications they could take and how much. And this kind of just depended on how long ago their addiction was. And she also had to keep careful track of medications because they had higher chance of being abused and were often used as a form of currency in the prison. So she had to be really careful with that. The system was getting better, though. Before she left, she got to see the prisons getting more resources and better training, and especially in things like hospice care and things like that. When asked if she ever felt unsafe when caring for these patients, she said never. She became really close with all of them, and they were all very protective of her. Also, when I asked if it mattered to her that they had committed a crime, that they were there for some really dangerous things and stuff, she said no. She said it wasn't her place to judge them and that it was just her job to be a good nurse and to take care of them, and that's what she did. And she got really close to them and made really close relationships with a lot of people. So
some facilities provide on-site care while others have off-site locations that patients are transferred to. On-site locations often utilize other inmates to serve as volunteers, which can be great for the patient because this means that they will not die alone, and it also gives the inmate volunteers a chance to care for others and find a purpose again.
So some of the cares that are provided would include just some of your normal things, like, for example, the activities of daily living. So including bathing, feeding, grooming, dressing, so normal day-to-day things. And then also if there's like more specific stuff, like letter writing is included. Let's see, transportation to and from places that they need specifically that's approved by, of course, their palliative care team. Emotional and social support includes like spiritual and religious support, like we talked about the other week. And then there's other things too that we've seen or that we looked into, which like singing was a thing, companionship. And then of course, if they can't keep up with housekeeping, then that can be provided too. Um, Cleaning and disposing of blood and body fluids. Just even maintaining the patient's bedside area to keep it kept, I guess is the word. Other things too that I thought was pretty interesting is that although they are inmates, HIPAA HIPAA is still applied. So, for example, protecting patients' privacy and confidentiality, so that does not change. So I thought that was pretty cool too. Of course, there's also the care prior to and after death. So, comfort care, postmortem care, and then, yeah, those are just some of the cares that are provided.
Okay, and these are some comparisons of Medicare certified hospice and correctional hospice. So with traditional care, it's insurance funded, the interdisciplinary team is required, the family involvement is highly desirable, and bereavement care is mandatory. Whereas with correctional care, it's not insurance funded, the interdisciplinary team is not required. There's a wide variety and level of family involvement, and bereavement is seldomly provided. Both are patient-driven and have aggressive symptom control, and the prognosis has to be 6 months or less, and a DNR is not required.
So, how is it covered? Dun, dun, dun. Okay, so inmates are unable to apply for Medicaid or Medicare. So that's something new that we learned. So the state government covers most of these costs. So taxes? Okay, so the Department of Corrections estimates spending more than 10% on the annual budget for elderly care.
Okay, and we just want you to remember that it is seen as unethical to deprive inmates of adequate health care, including palliative care. Incarceration is the intended punishment for the crime, not poor health care. So many organizations are working on providing better palliative care to the incarcerated patients.
Okay, so now we just have a video that we want to show you guys that kind of went along with our topic here.
Murder. First degree murder, 7 years on death row.
I was convicted of second-degree murder. I walked in the house, shot her and left. This is the worst of the worst inmates.
Guy came to buy some drugs. He wound up getting shot.
I thought I had to be like everybody else, a savage animal.
It's pretty tough prison.
This is Louisiana State Penitentiary at Angola.
The average sentence here is about 93 years.
More than 85% of Angola's inmates will die in prison.
They know I need the bobs. They keep setting it back. I need help.
I know you do.
I'm watching dudes die here daily. Ain't nobody going home. They got life sentences. This is death.
Hospice is a way to die with dignity with your family. And this is their family.
Can we do anything for you?
Why am I here? Sometimes I don't know why. It's just something in me that just want to do the opposite of everything bad I ever did.
Everybody can't handle, just being around the time.
Oh. I don't know if I could be that person that sits there when the patient dies.
I wouldn't volunteer to do it, but they do, and I appreciate it.
How you feeling? You all right?
Feel helpless. One of those breaths could be his last one.
You put so much into it only to watch them die. something in you gonna open up, or you not human.
Okay, brother. Rest in peace. For the guys that have done this for years now, had they had the compassion they got now, had they had it on the street, they would have never committed the crime they committed to come here.
Hospice is referred to as a process of helping one die with dignity. But more than that, I feel it's helping one live our life with love.
Hospice is the ultimate test. Have you changed or have you not? This is your chance to prove it.
A group of inmates are about to put themselves to that test.